10 to 7, Laura James with you this Friday morning. We'll catch up with Gordon in a moment as well. But first, let's get more on the NHS now and how it's tackling the coronavirus outbreak. Nurses and doctors are on the front line treating patients with COVID-19, and particularly those working in emergency medicine. We've all heard the problems with a lack of specialist protective equipment for NHS staff dealing with infected patients. But actually, how bad is it? Well, let's talk to Dr. Katherine Henderson, President of the Royal College of Emergency Medicine. Good morning.
Good morning.
What's the latest on the situation regarding protective equipment for NHS workers?
So yesterday, new guidance was published, and that new guidance is very reassuring for staff in hospitals, in primary care, in social care. It also is based on being able to deliver the right amount of kit, and we're told that they're now confident that we'll be able to get the kit to the right places. So we're really hoping that we're going to be able to move on from the protective equipment story, and that actually it's all going to get there out to the front line. Where I'm working, I'm in central London when I'm working, where we have already got an awful lot of patients and we've got the kit that we need.
Well, there are other big issues, aren't there, facing emergency doctors that perhaps have been overlooked so far?
So at the front door, one of the worries that we have is it may seem quite odd to people, but we have a slight worry that there are patients who should be coming to hospital, who maybe aren't coronavirus patients, but who've got significant health problems, who are not coming. So we've seen a drop off of people presenting with heart attacks and strokes. Well, the likelihood is that those events are still happening. So one of the messages that we would like to get across is to say to people, if you have got a serious health problem, please do get in touch with the NHS. It would be terribly sad if people came to harm because they weren't coming when they should be coming.
Well, because they're worried about wasting your time, aren't they?
But they're worried about wasting our time, and they're worried about catching something if they come to the hospital. And I think we all understand that worry. But there's a real message out here, particularly around children. The last thing we want is a child having their illness not spotted because they're not coming. And we're separating our departments so that we've got respiratory areas, the people who are likely to have coronavirus, and areas where it's less likely. But we're protecting everybody now by wearing the kit. And now that we've got the kit going out there, we can do that. But my message would be, if you've got something that's seriously wrong with you, please don't ignore it, and do come to hospital still.
Thank you very much. Very important words there. And I'm sure a lot of people listening at the moment will resonate with this and think up until now, no, I'll stay away. But actually, the hospital is there for everybody, for all reasons. Thank you very much, Dr. Katherine Henderson, the President of the Royal College of Emergency Medicine.